iMumz presents another Ask Me Anything session, episode number 159. And today I would like to welcome Dr. G.K. Bedi right from Chandigarh who has joined us for this session. She'll be guiding us today on what are AFI levels and how to maintain them. Let's know something about Dr. Dr. G.K. Bedi is an obstetrician, gynecologist, and infertility specialist. She has experience of 37 years. She is the director of Bedi Hospital in Chandigarh. She has been running Bedi IVF for the last 19 years. She is the founder president of ISAR Chandigarh Chapter and a member of various societies like IMS, IFS, FOGSI, COGS, etc. I welcome you, Doctor, again on the session. Let's get started.
Thank you. Thank you, Pooja. Thank you for the kind introduction. Today, my talk is on amniotic fluid and its importance. As we all know, that nature, with all its glory, is more beautiful than any piece of art, be it any painting or be it any sculpture or anything like that. And Mother Nature, as we all know and we have read, they say that she started her course underwater. And in humans, underwater life means basically amniotic fluid. So when I come to amniotic fluid, I would like to remind you that our life or we came into existence underwater. That's why we are comfortable underwater and the concept of underwater delivery came into being. So when we talk about this amniotic fluid or the underwater or the fluid around the baby, what can I say about it? It's a beautiful thing. You know, you have the uterus, you have the baby, and you have the fluid, and of course, the placenta or the working element between the mother as well as the baby. All this constitutes the gravid uterus, what we call a pregnancy unit. This pregnancy unit has to function properly so that the outcome is very good and we have a live birth at term. Now, this amniotic fluid, what is this fluid we doctors keep on telling about, and we keep on asking you or telling you, yes, the fluid level is all right, yes, the placenta is all right. Well, the formation of amniotic fluid, it starts as early as 12 days after conception. Means as soon as you get pregnant, the unit starts functioning and the amniotic fluid starts forming. So, thus, the baby is always surrounded by fluid. In the first 20 weeks of pregnancy, the fluid is generally from the maternal side, that is from the mother's side. Could be from the blood of the mother. It comes into, seeps into around the baby. And after 20 weeks, the baby takes care of the formation of this fluid. What does it show? It shows that this fluid is very, very important. In the first 20 weeks, the mother takes care of this fluid, and after 20 weeks, the baby starts producing urine, and this urine comes out into the amniotic fluid and forms the basic bulk of the amniotic fluid where the baby can survive. What is the function of this amniotic fluid? Why are we so always perturbed that the amniotic fluid is less or the amniotic fluid is more? As you know, the function of the amniotic fluid is multiple. First and most important function, it forms a protective layer again around the baby. It serves as a cushioning effect for the baby. Third, it helps fight infections. Because of the fluid around the baby, no infection can travel up to the baby and the baby is quite safe in the womb. So the infection does not travel up to the baby. Another important aspect is it regulates the temperature. It might be cold inside, it might be very warm inside, but the amniotic fluid keeps the baby warm at the body temperature, which is very, very, very important. So these are the very important aspects of the amniotic fluid. And of course, the others are it helps in the lung development of the baby. We keep on talking with the baby, lungs should be mature enough. This helps you. The amniotic fluid helps the lungs of the baby to be maintained. The gastrointestinal tract or the esophagus with the stomach and the intestines, they get washed with this fluid. So it cleans the tract of the gastrointestinal unit as such. So amniotic fluid is very, very important for the baby. The function of the amniotic fluid and the formation I've already explained to you. Now I'll tell you how much is the fluid of the amniotic fluid, which is important for the baby to survive. We normally say that maximum amniotic fluid goes till about 34 weeks of pregnancy, right? Wherein we say around about 500 to 600, maximum 700 ml of amniotic fluid should be there, minimum. But of course, maximum it goes to 800 ml of amniotic fluid. After the 34 weeks of pregnancy, you will see a slight decrease in the amniotic fluid. And this decrease in amniotic fluid is there for nearly all the patients. Why does it decrease? Why is the amniotic fluid decreasing in the later stages of pregnancy? This is a very important factor for all of us, and we normally tell the patients that yes, it does decrease. Be careful about the movements because that is when we have to keep track of the fetal cake count or the fetal movements. Now, when the fluid is less or when the fluid is more, now, if I tell you the story of amniotic fluid, because it starts forming 12 days after conception and it goes on and on increasing, when you do your first scan or when you do the level 1 scan, you can see the baby floating in the amniotic fluid, very comfortably floating. This is the cushion effect of the amniotic fluid. And it also supplies nutrition to the baby. It's got proteins in it, it's got electrolytes in it, it's got hormones in it. So this then diffuse into the skin of the baby directly also before the skin is formed. So this can occur only till about 11 weeks of pregnancy because after that the skin layer forms in the baby and this does not allow the amniotic fluid to diffuse into the baby as such. But before 12 weeks, there's a certain diffusion of fluids or proteins or other immunoglobulins from the amniotic fluid into the fetal surface. So that is the importance of amniotic fluid. But if the amniotic fluid ruptures or what we call the amniotic fluid leaks, now leakage can occur at different times in the pregnancy. But what I'm talking about is something leaks in the first trimester of pregnancy, that is till about 13 weeks. What is leakage? How do you know that the amniotic fluid has leaked? Most of the patients they tell us, Doctor Sahab, garam sa pani nikla hai, yeah, I have peed. The most important thing is that okay, you talk to the patient comfortably, you peed, okay, you peed continuously. She'll say yes, I did not know when I peed. So that is very, very important link that the patient does not know when she has passed urine. So just make her comfortable. You at the back of your mind know that yes, it could be leakage of the amniotic fluid. When you do an ultrasound, you feel the baby crumpled up into the uterus and there's no fluid around it. It's very, very alarming because this could be impending abortion or a threatened abortion. And if it continues like that for 1 or 2 days, we might not be able to salvage the baby at all. Thus, amniotic fluid is very, very important in the early months of pregnancy also. But it happens in a few cases, it happened with my own daughter only, that she had severe leakage at 13 weeks. After that, it sealed and the pregnancy continued till term. So don't get frightened at all. We do expect miracles at times, and miracles do happen to us only. So please accept what is happening, but have faith in the Almighty also. So the amniotic fluid, if it leaks, we know there could be some impending infection, or in some cases, the cervix or the mouth of the uterus is very loose. Now, if it is loose, definitely she might end in abortion. If there's infection, whether it is a vaginal discharge, she could be having constant bacterial vaginosis, or it could be chronic urine infection. Now, these are the three most important conditions which we have to treat because premature rupture of the amniotic fluid or premature rupture of the membranes is well known in all these three conditions. So once we have ruled out infection, we go to the next part, that whether the cervix is loose or not. This can be checked with a transvaginal ultrasound. And if we see, yes, the cervix is opening up and we see a bag of membranes coming out into the cervix, We can apply a cervical stitch also at that time, which keeps the membranes intact. Of course, we have to warn the patient that no, it's not 100% safe. She still can have abortion in spite of putting the stitch. Now, in the early part, the chance of abortion is more, or the baby expels itself spontaneously if the bag ruptures. But the instance of rupture bag slowly decreases as time passes. We need a viability, that is viable, a fetus becomes viable at 24 weeks pregnancy at least, so that the lungs are mature and we can deliver the baby. Yes, we have had pregnancies or preterm ruptures at 24 weeks or 25 weeks when the baby was just about 400 to 500 grams. If you have a good support system, you have a very good NICU, you can salvage a few pregnancies. Because it is that time the lung is not very developed and you might not be able to salvage all the pregnancy, but never lose hope and try to go to your doctor and see whether the pregnancy can be salvaged. As the pregnancy goes on to about 28 weeks, 30 weeks, we are more confident because we have the backup with us and we know that, okay, now I'll be able to save the baby in spite of a rupture of the amniotic fluid bag. But how do you measure this amniotic fluid? Now, amniotic fluid is, as I told you, surrounding the baby completely. We measure it by an ultrasound. There were days when we were studying medicine, we didn't have ultrasounds. So we used to measure, or we used to come to know by a per abdominal examination itself, but it was never accurate. But of course, yes, that's the way practice was about 40 years ago. But with the advent of ultrasound, we have been able to measure the amniotic fluid, and one index is the AFI or the amniotic fluid index. Though of course, it is varies from observer to observer. It is a part of the biophysical profile or the well-being of the baby, wherein we see the level of fluid in upper two quadrants and lower two quadrants with the ultrasound machine. And anything between 8 to 25 AFI is considered as normal, but below 8 and above 25 is considered to be slightly abnormal. But now we have dropped this AFI and we don't mention AFI in our ultrasound reports. We go on to what we call as DSP or a deep single pocket. So one pocket of amniotic fluid should be there at least of about 2 centimeters. Normal range is between 2 to 8 centimeters. Now this pocket should not have any umbilical cord also over there. So that's on the ultrasonologist or your gynecologist to see. But we normally report yes, a single pocket of 2 to 8 centimeters is seen. That means everything is all right to the baby and not to worry at all. But if it falls below 2 centimeters, it's a matter of concern. So, what can happen when the amniotic fluid falls? And why does it fall? Now, if you come to the baby, if you see the baby inside the womb, what does the baby do? After about 12 weeks of pregnancy, baby starts swallowing food, the amniotic fluid, right? It swallows the amniotic fluid, goes down, goes into the system, and comes out as urine. About 10 to 15 ml of amniotic fluid is formed per day. Got it? It's not a big amount, so you really cannot change the amount of amniotic fluid. But about 10 to 15 ml is a fluid which is formed daily. So once the baby takes the fluid from the mouth and comes out through the urine, that is the passage which shows that yes, amniotic fluid formation is accurate. Now any obstruction over here, that is the esophagus, that can say yes, there is a decrease in the amniotic fluid because the baby swallows fluid, but there is no formation. It can increase, right? If the kidneys are not formed properly, or the kidneys are not functioning properly, or if there's obstruction in the ureter or obstruction in the outlet of the urine, there is decreased formation of urine. Decreased formation of urine again decreases the amniotic fluid. Then there are other factors also which can decrease the amniotic fluid. Now, when the amniotic fluid is decreasing, why are we doctors scared? Why are we always constantly measuring the amniotic fluid? because this amniotic fluid gives us certain signals about the well-being of the baby. Now, if the fluid is less, if it was a very good STA, it could be around about 8 centimeters, and now the STP has come to about 4 centimeters in a matter of 2 weeks. Why has the fluid decreased? Could be blood pressure in the mother. It could be the baby gives an indication that the baby is not developing very well. There could be a decrease in the weight of the baby, and these babies are going into growth restriction. Growth restriction means that they're not abnormal babies. The weight gain by the baby is decreased. Now, this can happen generally when the blood pressure of the mother is high. It could be due to chronic hypertension or gestational hypertension and other causes for IUGR or intrauterine growth restriction. So, in all these cases, the amniotic fluid decreases. That is an indication for us doctors to intervene. Now, whenever we say intervene, we always try to take up the pregnancy till it is viable, right? A viable pregnancy, as I told you, can, depending on where you're working and the NICU support. I would say if you have a good NICU support, go as much as you can. You can deliver a 28-weeker also, a 32-weeker also, a 34-weeker also. But if you don't have a NICU support, please refer this to a place wherein there is a NICU support so that we don't lose this child. Because as I tell you, all children are very, very precious, and it's very, very difficult to come to know that yes, you have lost your child because of decreased fluid or a premature delivery. So, when we see a patient with oligohydramnios or decreased fluid, we are extra careful, our alarm bells keep ringing, and we label this patient as a high risk patient. She's monitored more often, maybe every week. We do other studies on the patient also. Now, other studies of the patient could be a Doppler study, seeing the blood flow into the umbilical artery and the brain of the baby. Because if there's decreased fluid, we always feel there could be something extra also wrong with the baby. And of course, we also look for increased fluid, that is polyhydramnios. So, decreased fluid and increased fluid are quite important for all of us to monitor. Now, if there's any other question, I've slightly exceeded my time by about 2 minutes, but I think we'll answer all the questions. And if anything I can contribute more towards amniotic fluid, I can do so in the question answer session. Over to you, Pooja. Yeah, Pooja, are there any questions? So Pooja is not coming online. I'll tell another very important thing, like when you are going into labor and you've ruptured your membranes, look at the color of the fluid. That's very, very important. One, you see something very warm trickling down. The fluid color of the amniotic fluid is basically colorless, a very, very pale yellow. But anything turning to green is something alarming, and the alarm bells have to go off again that yes, it could be meconium staining, or the fetus could be, or the baby could be under distress. So that is a green colored meconium color of the amniotic fluid is one sign which we always tell our patients that if you rupture your membranes at home, please keep a pad over there and see the color of the amniotic fluid. There's no other way you can judge it. We cannot see the color of the fluid on ultrasound at all.
Hello.
Pooja. Yes, Pooja. I've sort of given them something about the amniotic fluid. So if there's anything else you want to ask or the viewers want to ask, or should I continue?
Doctor, we have got a lot of queries. So we
Yeah,
can start with the queries.
yeah, that's
Uh,
good.
in between, actually, my net connection got disconnected. So if it again happens, then doctor, I would request you to take the queries from the right hand side of the window. There are some comments, so you can pick the queries from there. Otherwise,
Okay.
I'm just reading them now.
Yeah, you just read them
So
out first.
yeah, let's start with the Surbi. So she is asking, after C-section delivery, what precautions she can take care, and her baby birth. weight was 3.9 kg. Now it is 6.5 kg after 2.5 months. So is it okay? Is it healthy weight?
Yeah, it is healthy. 2.5 months. First is, we'll take the first question first, that after a cesarean section, what are the precautions? See, we normally keep the patient admitted for 2 days, and normally she's fine by about 7 days after the section. We tell them to go home and do the work which is doesn't require too much of lifting of weights. That is looking after the baby, taking care of the baby, making a cup of tea, going to the kitchen, and so on and so forth. It's not very hectic at all, but I always tell my patients to take adequate sleep, because adequate sleep is one thing which is lacking in the patients who had a cesarean section. The second thing is latching. Latching of the baby or breastfeeding the baby is very, very important. It should be done immediately after the cesarean. Otherwise, the baby at times refuses to latch onto the mother. The weight gain of the baby, as per your chart, is pretty all right. They double the weight. I mean, it's 3.9. So wait for another 3 months and you'll see that the weight doubles. And of
Thank
course,
you.
you must be having your growth charts also. So maintain the growth chart, go to your pediatrician, they have a growth chart over there, which really tells you that the baby is growing fine. But 3.9 is a good weight baby actually.
Thank you, doctor. Next is from Priya. She's 19 weeks, 4 days pregnant, and it's her first pregnancy. She's asking which is the best time for TIFA scan, and along with TIFA scan, are what all are the tests she should do? Please guide.
See, if you're, how many weeks? I didn't get it, Priya. Priya is
It is 19 weeks, 4 days.
19 weeks, 4 days. So most probably, Priya, you had your level 1 scan, that is the NT&B scan, right? That most probably would have been normal because that's a first scan followed by a dual stream test or the dual marker. When you have approached about the 18 weeks plus, we go on for this anomaly scan or the scan wherein you can pick up all the anomalies called a level 2 scan. Along with this, we combine a fetal echo also at times. So, fetal echo along with a level 2 scan gives a complete picture, and it is a very good scan because it details each and every part of the baby, starting from the head, the nose, the thorax, abdomen, the liver. And we really don't advocate a quadruple test with it. But if she's missed out on the dual screen, yes, you can go in for a quad test also.
Thank you, doctor. Next is from Vanita. She's okay. In her 32 weeks ultrasound scan, her AFI levels were 25 to 26 centimeters. Her doctor asked her to reduce sugar, but already she is not taking any sugar content, not even sugary foods. He told her to cut down carbohydrates, which she is following. But is this much okay? Or what else she should do to reduce her AFI levels? She's 36 weeks pregnant now.
36 weeks pregnant with very high AFI, I would suggest that yes, the doctor should be worried. One, I want to know the weight of the baby, whether the weight gain is also a lot. So these babies are microsomic babies. Microsomia means that they have gained a lot of weight in the uterus. And the patient can have gestational diabetes. So gestational diabetes is diabetes which occurs during pregnancy. She's not a diabetic person, but pregnancy is considered a condition with stress. So it's a stress-induced condition which causes increase in the blood sugars. So we say diet restriction. We tell you to decrease your sugar intake, your carbs intake. We have to monitor your fasting and your PP levels. I really don't know what your OGTT level was in the beginning, whether you have a family history of diabetes, whether you have a previous child who is a heavyweight child. At times, there are families wherein the weight of the baby is always big, but of course, the lighter AFI is quite high in this case, and you have to. I really don't know how you're comfortable sitting at home at 36 weeks with the AFI of 45 is pretty high. So I think you should monitor yourself, and maybe the doctor plans an early delivery for you.
Thank you, doctor. Next is from Dharini. 26 weeks of pregnancy and having severe pain in right leg's calf muscle at night, so much so that she is unable to sleep. Please suggest her some exercise or medicine to relieve it.
Right. So when you have calf pain, there could be 3 to 4 points attributed to the right leg calf pain at night. One, it could be normal. Second, you might need certain vitamins like vitamin E and magnesium to relieve your calf pain. Third, you have to look for any clotting sign or any varicose veins. Varicose veins are quite prominent. They're normally seen at the back of the knee. So please look out for any veins which are swollen up over there, which can cause pain in that area. And third is look for any other blood factor like abnormal bleeding, clotting time, INR, which can cause clots in the veins. It is very, very rare, but there are few conditions, medical causes in patients which have DVT or deep vein thrombosis. Now, these are the other things which I'm just sharing with you so that you don't miss anything, but it's not very common. Now, how do you go about with it? If it's not related to any medical condition and it is just offhand, there are no varicose veins also. But if you have varicose veins, please try to have stockings because it's very important to keep the varicose veins under check, otherwise they'll keep on paining and they should not increase as pregnancy advances. But otherwise, you can get onto your physiotherapist and tell them to give you exercises for your calves. The simple exercises is one is flapping your feet, keep them straight in front of you and flap them this way and that way and keep on rotating. And you can keep on leg lifting also. If you lift up your leg, that will also help in pain relief. So one is flapping of your feet, rotation of your feet clockwise and anti-clockwise, and stretching of your legs if you don't have any varicose veins and other signs of DVT. These are the exercises which you should do along with a little bit of vitamins like magnesium and vitamin E. The next one, Pooja.
Thanks a lot, doctor. Next is from Samata. At 32 weeks, her AFI was 8.5 with single packet, 3.5 centimeter, and at 34 weeks, it's 8.7 with single packet 2.5 centimeter. Her doctor is checking fluid weekly and she is taking advised medication and diet. Till which week she can wait to deliver? Is it risky to wait after 37 weeks to wait to deliver? And less than what level of AFI one must opt for delivery? Baby growth, movements, NST, her BP, sugar, everything is normal. Still, why AFI is less?
So it wasn't too clear, but I'll just repeat according to you. There's no high blood pressure, but what was not mentioned is the weight of the baby is not mentioned in your findings. So I would like to know if the baby is growing well. Number one, if the baby is growing well, the weight is good, we can wait. We can do a weekly ultrasound to see the AFI or the SDP. I would say a single deepest pocket is more accurate than an AFI. So if you say AFI, we don't take an AFI. We try to do terminate the pregnancy when the AFI is less than 6, and single deepest pocket should be not less than 2. Anything less than 2 pocket or less than 6 AFI means pregnancy has to be terminated. Termination means what? Termination means starting the pains early. And why do we try to start the pains early? Because when the fluid is less, the umbilical cord doesn't have any support. The amniotic fluid supports the umbilical cord so that it does not get compressed and the blood flow to the baby is not hampered. But when the amniotic fluid is decreased, the cord compression is there and the blood supply to the baby is decreased, the movement to the baby can decrease, and we might have a compromised baby or a lethargic baby or a baby who's asphyxiated. So it's very important to keep the amniotic fluid above these levels, that is SDP of at least single pocket of at least 2 and AFI of at least 6 to 8. Anything less than that, I would think that if she's reached 36 weeks or even 35, 36 weeks, the pregnancy should be terminated. Of course, we do give a bit of steroids at times. So So that is a personal choice depending on the patient profile. The doctor can give the injections so that we know that the lungs are being matured before we take out the baby.
Thank you, doctor. Next is from Akanksha. At 28 weeks of pregnancy, she is having navel belly pains at times and vagina white, cheesy salt discharge. So, is it normal, doctor?
Cheesy discharge is not normal. That shows she's got fungal infection, so it has to be treated. Any kind of discharge, I told you, should be treated in pregnancy because it can cause premature rupture of membranes. That is leakage of the amniotic fluid and premature deliveries. So definitely this has to be treated. Now, the navel or the belly pain. Belly pain is very, very common. And why is it common? Because belly is the point where all the fibers join, is the toughest area, toughest but thinnest area, because all the muscles join in the belly. So at times you have that prominent belly pain, and at times you see sort of the belly is being pushed on top. So this is the abdomen and the belly gets pushed due to the intra-abdominal pressure. The pressure of the baby is such that it pushes the belly button up. So that is due to the raised intra-abdominal pressure of the pregnancy as such. And after pregnancy, it generally settles down. So belly button pain is very, very common. There's nothing much you can do about it. I tell the patient when you have this kind of pain, take a side and lie down. That at times relieves the pressure. So this left lateral position is to relieve the pressure in these conditions.
Thank you,
Next.
doctor. She
Yeah.
has one more question. Uh, it's it's from her friend actually. She is also 28 weeks pregnant, and can she have 4 hours journey by car? Is there any medicine to take before journey?
I don't think so if she's having a normal pregnancy. We normally don't give progesterones offhand. There are few doctors who do believe in giving progesterones, but if everything is all right, the mouth of the cervix is closed, there's no infection, she's not having premature pains or something, I don't think there's anything. She can have a journey of about 4 hours. But yes, I would always say after 2 hours, take a gap, step out, take a small walk, and then go ahead for the other journey again. Don't take a continuous journey for 4 hours. Break your journey. So that is if you're going by car. Even if you're flying, if you're out in an aircraft, you should always take a walk on the aisle so that you really don't get stuck up with cramps. The blood circulation should always be there in your calf muscle. That's very, very important. Otherwise, you can have swelling in your feet, which is due to gravity also and the pressure of the uterus, which does not drain the lower parts easily. So it's very important to be mobile off and on.
Thank you, doctor. Next is from Daisy. She is 35 and she had 3 miscarriages all in her first trimester. She did IUI 2 times but not successful. Tried IVF first time on 8th of September but unsuccessful with donor egg. Please let her know what precaution should she take for her second IVF on 12th of November. She is taking all the medication as per the doctor prescribed. What's the reason why pregnancy is not successful?
Okay, Daisy, that's quite difficult to answer without seeing all your reports. But one thing I know, you're 35 years, you've had 3 miscarriages, you've done one IVF with donor eggs. So if you've had miscarriages, I feel yes, you have to test yourself. Certain tests should be done on your blood immunity system, whether you negative or positive. The second is look at your uterus. I would like to have an IVF failure also with donor eggs. Now, the second point is that apart from testing you, I would also like to see your husband's semen, because I really don't want it to be the attention to be shifted from the husband to you. The focus should be your husband also. Please look into his semen. If it's a low count, if the sperms are not very active, if the sperms are, they are morphologically abnormal, we could be looking at a male factor also. So please look into his semen. which could be responsible for recurrent miscarriages and the first IVF with donor eggs, which has failed. So I think looking at the husband, treating the husband if needed, is very, very important. And of course, you should
Thank
go
you.
in for a second IVF. You should take all medicines as the doctor is prescribing you. But I'm sure she must have done the APLA profile, we call it, for recurrent abortions. So that is very, very important. And look into the uterus, maybe a hysteroscopy, I'm sure it must have been done, to see whether there's anything abnormal in the lining of the uterus and why the pregnancies are not taking up in spite of taking a donor egg. So we are not blaming the egg per se, but yes, after taking donor eggs, the uterus should be receptive enough to receive the embryo. So why it is not receptive? One, the uterus could be at fault, and second is the semen could be at fault, or maybe we have to do an ERA test, which tells us what is the most receptive time to give the embryo transfer or give the embryos back to you. So I think there are a number of issues I really cannot say offhand until we have scanned all your reports.
Thank you, doctor. Next is from Bharti. 38 weeks, 2 days pregnant. For last 2 days, she felt pressure in vagina and in lower abdominal whenever she walks, then only. But today, even while walking, no pressure. May she know why is it happening? And her AFI is 10 centimeter, cervix 4.2 centimeter, baby weight 2 kgs 160 gram in 36 weeks scan. May she know till now, how many more weight baby could have gained till now after scan? Is it safe to deliver low weight baby? Until what time she can deliver?
Wow, that's a huge question. 38 weeks, 2 days pregnant. It's a term baby. We don't call it a premature delivery, right? And she was 2.1 kg in the 36 week scan. So definitely the baby must have gained weight by now. She must be minimum 2.5 kgs. So if she's 2.5 kg, that's an average weight of a baby. So 2.5 baby is not an underweight baby. That's the average Indian weight baby. So she can deliver anytime. And the weight of the which is feeling in the vagina could be just pressure. Yes, the blood vessels get really vascular. There's a heavy congestion in the vagina towards the end. That is one factor. You always feel heaviness in the vagina. Second is that the head tries to adjust itself into the pelvic circle or the pelvic girdle. That's when you always feel a heaviness. Some ladies say something is stuck over here. So that's the head. So the head tries to get into the pelvic brim and enter the pelvis. So that's when you feel that weight and you feel it's quite painful, it's quite annoying also because it's very difficult for you to walk. But for you, you are saying today there's no pressure at all. So maybe the head is just rotated somewhere and the pressure has gone. So it depends on the doctor. If the AFI is normal, the baby is gaining well, your blood pressure is normal, she can wait for normal pains to start also. There's no need to interrupt pregnancy at this stage.
Thank you, doctor. Next is from Shiva Ramya. In 31st weeks of pregnancy, she was tested COVID positive yesterday. Only symptom she had is loss of smell and no other symptoms. Her doctor has asked her to go for LFT, RFT, ferritin, D dimers, PT, APTT, CRP, LDH, and interleukin test, and also asked her to use following medication till test result come. Start Ecosprin 75 mg twice daily, with C, zinc COVID, and azithromycin 500 mg once daily for 5 days. She wanted to check why are these tests for and is it safe to use Ecosprin in pregnancy? What precautions she can take for COVID?
Pooja, how many weeks is she? How many weeks pregnancy was it?
31 weeks.
Okay. So, for all practical purposes, she's a 31-week pregnancy with COVID positive, right? So, first thing is she has to be quarantined. She has to be separated from everybody at home. She has to go along with all the investigations. They're very safe investigations. They are the investigation done for a COVID patient. So there's no other thing. She has to go ahead with all these investigations, and especially she's pregnant. So we don't want anything to happen during pregnancy, means any alarming symptoms to occur during pregnancy. As far as the treatment is concerned, I'm very happy they've started on vitamin C and zinc and AZ. They're standard treatment protocols which are given to all the patients. And of course, they've started EcoSprint also. There is no harm of taking EcoSprint in pregnancy. At times, we started as early as 6 weeks. At times, we started even before the patient conceives. And we take on up to about 36 weeks of pregnancy or 38 weeks of pregnancy. So taking aspirin or EcoSprint in pregnancy is pretty safe. So I don't think they're doing a wonderful job. I think whatever they have written is absolutely right, and she should follow the treatment as per protocol.
Thank you, doctor. Next is from Simpi. She is 11 weeks, 6 days pregnant, and as per her sonography, her LMP was 19 June, so she should be in 14 weeks. She had first sonography on 6th of August, which says 5 weeks, 2 days. Then she had her next sonography on 24th August, which says 11 weeks, 2 days. So why is this? Is her
No,
baby small?
when we have to do the dating, now you have to do it from the first ultrasound scan. So if you go back to the first ultrasound scan, on 6th of August, she was 5 weeks and 2 days. I'll have to write it down, so you have to go slow on that. On 6th of August, she was 5 weeks, 2 days. Uh, on 19th of June, she was 11 weeks and 6 days. Okay? So 6th of June, July. So, what do you? I'm not getting it right. Can you just tell me? I'm
Hello.
no. Give me the previous one. See, this is something which I'll have to write and do it. I think there's something wrong here. There's something wrong here. First sonography on 6th of August नहीं हो सकता ना ये. 19 June is LMP.
Doctor, she
19
has
July.
mentioned on 24 August, it was 11 weeks, 6 days.
So June she had a periods on 19th of June, July and
Yes.
August, 8 weeks, 19th. So it's absolutely all right. 24th of August, 11 weeks, and what she's told before to the
She's asking doctor, like, why is this so? Is her baby small?
it could
Maybe,
be
I guess.
delayed conception. That is, you conceive slightly late in a few cases. Otherwise, the baby is not small at all. The baby is not small. It could just be a case of delayed conception when the egg formation is slightly delayed. Right?
Sure, doctor. I guess she had some confusions. Okay.
24th September, she something.
She's saying 24th September, it is 11 weeks.
Huh. See, she had a periods on 19th of June.
Yeah.
19th of July, simply, are you listening? 19th of June was your period. 19th of July, you become around about 4 weeks plus, and 19th of August, you become 9 weeks, right? 19th of September, you add another 4 weeks, and that becomes 11 weeks. So it is not less at all. So 11 weeks, 6 days. Got it? So that's the
Thank
way
you.
we see the Olympic charting is done from the first day.
Thank you, doctor. Next is from Meenal. She is in her 23 weeks of pregnancy. Last few days, she had period-like feeling. She gets for fraction of seconds, few times a day. However, no spotting and baby movement is also okay.
Period like pain, Minal, could be just crampy feeling at times. Ladies do get. The pain is generally at the back. Now, there are two, three types of pain. One could be due to the posture. Your posture is not good, you're sitting too much, you're on the laptop too much, working too much, that could be one. So your muscles are tired and exhausted. Second is that your uterus is cramping a bit. It gets active at times, but these are not labor pains. So I think if you're crampy like feeling, first is lie down, take rest. That's very important. Test on your urine also. If you have any urine like feeling or urine infection, which could cause this kind of a pain radiating from the back and coming onto the front, right? So one is take rest. Your posture could be wrong. So posture has to be corrected. You have to take rest and look into your urine to look for any infection which could give you some pain like that. If in spite of that you still have the cramping which continues, the doctors have to do an internal checkup to see whether the mouth of the uterus is opening up or not, right? That's very important that the doctors have to do. And if something is there, if they see any sign, they could you start on some kind of medicine to relax the uterus.
Thank you, doctor. Next is from Chitra. She is 14 weeks pregnant and she has severe pain in wrist, elbow, and calf pain. Is it normal or should she do something? Even doctor told her she is having low lying placenta. So, any solution for that?
So one is the breast pain. Breast pain is common in pregnancy because the breast size increases during pregnancy, and the alveoli and the fat component also increases. The alveoli expand, so the breast size increases and causes pain. And the milk formation is there. The alveoli gets increased. So that is one issue. The second is calf pain. I've already told you they have to take medicines, vitamins, and a lot of hydration. I think the patients not taking water, they have more of calf pain. So if you have calf pain, take hydration and do exercises. Third is your low-lying placenta. I really don't know the degree of placenta. At 14 weeks, we hardly say most of the placenta are slightly low-lying at 14 weeks. So just wait and watch with the passage of time as the uterus grows, the placenta does move upwards. But in the meantime, I think it's best that she avoids intercourse or avoids exertion or heavy travel or heavy work. She should take it slow for some time until the doctor gives a green signal that yes, everything is okay.
Thank you, doctor. Next is from, okay. She is 7 weeks pregnant and suffers from frequent lower abdomen cramps. Although there is no vaginal bleeding, is there something to worry about? She travels 70 kilometers each day by car.
Now, I think if you are 7 weeks pregnant with abdominal cramps, yes, I feel traveling could be one issue if the travel is 70 kilometers each day by car. So, one is the bumpy roads and the posture. So, I think the doctor might advise you a little bit of progesterone to relax the uterus. Just see if that works. Uh, Otherwise, maybe you'll have to go for a bit of bed rest also. If bed rest helps, that means the uterus is relaxed when you're taking rest, and that is what you have to do. You have to take a few days off before going back to work again. So abdominal cramps have to be looked into. Of course, always check your urine when you have abdominal cramps because UTI also can present in that way.
Thank you, doctor. Next is from Vaishu. Does the baby's placenta position decides the sex of the baby? As she came to know that it's boy if it's in posterior and girl if it's anterior. Is that true?
Wow, this is the first time I've heard that the placenta decides the sex of the baby. No, not at all. Not at all. It's a very new question or a myth, I can say. But of course, the placenta can be anywhere. I mean, it just cannot decide the sex of the baby at all.
Thank you, doctor. Next is from Vaishnavi. She has severe pain in the vaginal opening area. Her urine tests are normal. She is unable to pee freely as she is unable to contract or relax that area easily. May she know if it is normal? She doesn't have any burning sensation. It's just weird pain and when she widens that area. She is 27 weeks pregnant.
She's 27 weeks pregnant and she has difficulty in passing urine, right? That's what I, because it was cracking the voice. Is it
Yes,
right,
doctor.
Pooja?
Yes,
Okay,
doctor.
and she does not have any urine infection.
Yeah, she doesn't have any urine infection nor any burning. It's just weird pain when she widens that area.
When she widens that area. So that's what happens during pregnancy. The whole pelvic girdle and the muscles they relax during that time. It's a hormone called relaxin which helps the ligaments to get loose. So that vague pain it persists. So I really don't know what she's trying to say. There's no urine infection. There's nothing of that kind, but she has a vague pain down below. Now, vague pain down below is not always urine infection, but it can be due to pregnancy per se. It could be due to varicosities, like I told, varicose veins at the back of the legs. They could have varicose veins in the vulva area. They could have varicose veins in the vagina also. All these also cause a throbbing pain as well as a vague pain or a weight hanging down. So this is very important for the doctor to check if she's not suffering from any varicose veins. Second, if the urine is alright, we look for other things. That is basically the posture she's sitting. Is she's always sitting on a chair? If she's always sitting on a chair, I've seen these girls who are all IT professional or working long hours. They do have this vague kind of pain when they get up. They have these feeling that as if something is coming down. So it's very important for her to take more of rest, I feel, and have one examination from a doctor to look for any other abnormality which we have missed during the earlier checkups.
Thank you, doctor. Next is from Marti. She's in 25th week of pregnancy and she already got her level 2 scan done. And now, which is the next scan, which is due for her, and how many scans are there in third trimester?
Uh, well, you had your level 1, level 2 scan. There's no fixed amount of scan. As per the government's regulation, at least 3 scans are mandatory. But I think it depends on your obstetrician, like what she wants to do or how confident she is. If she feels yes, she can make out the baby is growing well on a per abdominal area, the fluid level is good, the position of the baby is good, it's all right. We all used to do that before. But now with modern day obstetrics, the scans or the number of scans have increased. There is no upper limit to scanning, but of course, injudicious use of scanning is also not done. So, do a scan or have a scan done only when indicated by the doctor. So as I told you, there's no fixed number of scans, but when we feel, yeah, yes, the baby is too big, or the baby is too small, or the baby is not moving properly, or we feel the position of the baby is not all right, that is nearer to 40 weeks, we always go in for another scan. And we call it a third trimester scan or a growth scan. So the various names given to the scans which are done in later part of pregnancy. So if the baby is not growing, we call it a growth scan. If we feel that yes, we need to know about the blood flow to the baby, whether the blood flow is compromised, especially in these patients who have high blood pressure or diabetic patients. We normally want to see that how is the baby faring. We go in for the Doppler studies in these patients. So these are very important scans because they give us the information when to terminate pregnancy, whether to go on for a normal delivery and wait till she starts the pains, or in a few cases we have to intervene before that, maybe at about 37 weeks or 38 weeks, or whenever the baby is not moving too well or the blood flows are compromised, maybe we have to start the pains early and admit the patient before. So I think that really depends on your obstetrician, the dealing obstetrician. There is no fixed number of scans for any pregnancy.
Thank you, doctor. Next is from Shalini. What is follicles? Her left follicle is 7 mm and right follicle is 6 mm and her uterus is bicornuate uterus. Please suggest what she can do.
I presume, Shalini, you're married. So you have a bicornuate uterus and your follicle is 7 mm, 6 mm. They are normal. I mean, anything below 10 mm is normal. So follicles are round structures in your ovaries, which as they grow bigger, the egg matures inside these follicles. So you might have 3, 4 follicles in each ovary, which are picked up every month. One follicle generally grows, that's called the dominant follicle. It could be on the right, it could be on the left, and this follicle, dominant follicle, generally has an egg. So during mid cycle, when the egg ruptures, the egg is released, it enters the tube, and that's when the patient is asked to go ahead for intercourse, and we plan the pregnancy accordingly. So that is a monitored cycle or follicular monitoring, wherein we tell you that yes, the follicles are ripe and the follicles should have an egg, and it is the right time to go ahead for intercourse to increase the chance of pregnancy. So follicles are small, you can say round structures which have eggs, and they are present in the ovaries, the right and the left. You are born with a fixed number of eggs, and all these eggs are covered with coverings called follicles.
Thank you, doctor. Next is from Ernest Levin. 34 weeks, 3 days pregnant. Her AFI level came 21 and baby is 2.7 kg. How can she take care of this increased water level? And she is experiencing a lot of baby movements from some days. Is there anything to worry, doctor?
Uh, at 34 weeks, 3 days, your AFI is 21. The baby weight is or slightly on the higher side for 34 weeks, yes. And I think your GTT levels, I really don't know. Maybe you're a borderline diabetic. So if you are a borderline diabetic, I would say that yes, you need a diabetic diet wherein we monitor your calorie intake, we monitor your carbs, we do a fasting and a PP every time. So, or we do a post breakfast, a pre breakfast, post breakfast, and pre dinner and post dinner. So, blood sugar monitoring is very, very important. And I really don't know whether you are on any medicines for your blood sugar. Are you on insulin? Do you have a family history of diabetes? Or you had diabetes in the previous pregnancy, I do not know. But if you're a pre diabetic or a GDM or a gestational diabetic and you're 34 weeks, 3 days, and the baby weight is 2.7, we do expect that the baby weight will rise to 3 to 3.5 kgs minimum at 40 weeks. So we take it then and there. We normally monitor these patients, a diabetic patient, till about 37 weeks. So between 37 and 38 weeks, we would like to terminate pregnancy, especially if the water level is increasing slowly. So I really don't know. We have to monitor the patient closely. The baby movements have to be monitored very, very well in these patients. So I think she has to meet the doctor every week.
Thank you, doctor. Next is from Tripura. Her AFI is 5. She is 30 weeks pregnant. Baby weight is 1200 grams and IUGR. She is getting IV fluids once in 3 days and drinking arginine sachets twice daily. What should she do to increase AFI levels and baby growth?
Uh, AFI is 5 at 30th week, weight is 1.2. Okay, it could have been 1.3, 1.4. It's not that bad a weight, but it's all right. I don't know. We are there's no authentic evidence to say that you have to take IV fluids once in 3 days. There is no evidence. Drinking arginine sachets might help, but documented proof is not there. We do give arginine, but it might increase the AFI, but of course, documented proof is not there. The only thing is that we tell the patients to consume a lot of water, hydrate yourself well, and look for other conditions which might be decreasing the fluid level. It could be your blood pressure, that is not mentioned over here, because the blood pressure can be high, which decreases the fluid to a certain extent. And of course, we must have looked for other reasons like infections and so on and so forth in the second trimester. But per se of taking IV fluids once in 3 days, I somehow am not in favor of it. And drinking arginine sachets twice daily is all right to a certain extent, but not many studies to prove it. There's nothing much you can do to increase your AFI levels. AFI is 5. I'm not very happy with the AFI. So if the AFI is 5 and you've taken all these, the baby is in the 30th week, I would say you might need to terminate the pregnancy soon. So you take a steroid cover for lung maturity because at times a 30 weeker might not have very mature lungs. So to decrease the stay in the NICU and to decrease the use of surfactant, I would say take Dexa 6 mg twice a day for 2 days. That is a total of 2 doses before we can really go for termination of the pregnancy. I would not like to take out the baby when the AFI is very, very low. AFI 5 is pretty low. So you please be careful.
Thank you, Doctor. Doctor, if you allow, can we ask two, three more queries because we have, uh,
Yeah, you
though
can.
we are time. Okay. Thank you, Doctor. Next is from Anita. 24 weeks of pregnancy. At 20 weeks, her AFI is 7. Doctor gave her some antibiotics and arginine till 15 days. Then AFI is 7.8. Please suggest her to increase AFI and write guidance regarding successful pregnancy.
Anita is 24 weeks pregnant and at 20 weeks your AFI is 7. It's pretty low. So this pregnancy has to be followed very, very carefully. I would say you have to tell, I think the obstetrician, your doctor must have done the look out for any torch tests. I'm sure they must have done to look out for any intrauterine infections, which are a major cause of decrease in the AFI. The level 2 scan must have done seeing the kidneys, whether your kidneys are functioning well, the bladder is filled well. Now these things have to be looked. So I really don't know about your level 2 scan. So level 2 scan is very important, especially the AFI is low. Now, AFI 7 to 7.8, I don't think there's much of difference. There could be a difference in observership or the way we put our probe. So basically, I would say the AFI is the same at 7 to 8. So this is a very low AFI at 20 weeks. This child has to be followed up. We really don't know how long the pregnancy can last, but of course time will tell. There's nothing much which we can do, but yes, we have to rule out everything like basically intrauterine infections. Do a fetal echo has to be done for this patient also. A detailed scanning has to be done. And I don't know the role of antibiotics. I don't know why antibiotics were prescribed, but I'm sure the doctor knows well that the antibiotics were given for a certain reason. But of course, yes, we have to look for other intrauterine infections. Why the AFI is low? You should ask the patient whether she's had any leakage, like amniotic fluid. At times, the patients don't even tell you that there's leakage of amniotic fluid because the amniotic fluid at 20 weeks is very, very low AFI. So maybe she really doesn't know. Maybe she's thought कि मेरा बस urine निकल रहा or something like that. But proper questioning of the patient might really tell us yes, she could have a leakage, amniotic fluid leakage, which has been going on for quite some time. So maybe that's why the doctor gave some amniotic fluid. So the benefit of doubt should be given to the patient. So proper history taking is very, very important. So if the fluid is decreasing constantly, you have to take a different course of action. At times what happens is leakage seals. There's been a leakage of amniotic fluid leak and then it stops all of a sudden, then amniotic fluid builds up. So I think you have to wait and watch. Don't give up totally. But yes, it's a high risk pregnancy. We have to follow up this patient for quite some time.
Thank you, Doctor. Next is from Sanchana, 31 weeks of pregnancy, and she's facing a lot of constipation issues. So, would you please suggest what can she do? Also, other to-be moms are also facing the same issue.
Constipation, is one of the first signs of pregnancy. When you ask, when the patient comes and tells you that I missed my period and I'm constipated, at times I think, oh, she could be pregnant. So what happens is the slowing of the bowel movement slows down during pregnancy, right? So the constipation occurs, and your diet is such that you don't have a proper diet. Secondly, and thirdly, maybe your water intake is not sufficient enough. So you have to increase your water intake for a good bowel movement. You have to have a lot of fiber for a good bowel movement. If it's not being improved with the food you take, I think you should add fiber to your diet, artificial fiber in the natural form also you have. You can have isabgol in your meals, that's pretty alright, or the artificial ones which have husk or which can improve the bulk of the motion. So the bulk of the stools increases, you'll be able to pass it better. Because otherwise, if you keep on straining during pregnancy, you might have piles, you might have hemorrhoids, you might have prolapsed piles. So this is one of the side effects of pregnancy. So be careful about constipation because very, very common in pregnancy and take it very, very seriously.
Thank you, doctor. So the last question of the session. As doctor, I mentioned about a COVID patient at 31 weeks. She is asking, will there be any harm to the baby due to COVID and will it impact her normal delivery?
No, not as yet. You're just 31 weeks. We have had a number of deliveries now in India also. Of course, you were seeing at statistics from China and USA and the deliveries in UK. None of them, the babies were pretty all right. Nothing happened to the babies as yet. And in India also, we've had a number of deliveries with COVID positive mothers, but the babies have been turned out and pretty all right. So I don't think you need to worry about the baby as such. Look after yourself, eat well, take your vitamins, and I think stay at home and stay safe. That's most important. After about 15 days, you can repeat your test. The RT-PCR has to be repeated till you are negative, and only then you should be able to go out of the house. And if anything happens in between, you please refer yourself or go to a COVID positive hospital wherein they deal only with COVID patients. Because at times COVID can behave very erratically. So I would suggest that please book yourself where they see COVID patients and not in other hospitals.
Doctor, she has mentioned in her growth scan there are two rounds of cord around the baby. So is normal delivery possible with two rounds? The same patient.
Uh, See, loops of cord can unloop, they can unlock as well as come round again. So the baby is always moving. At times the cord is round the neck, at times the cord is off the neck. So yes, we do get reports wherein they have mentioned two loops of cord around the neck. But if it's a loose loop of cord, there's nothing to worry at all. But if it's a tight loop of cord, that only time will tell that when the baby is coming down and how fast the labor is. If the labor is fast, the baby comes even with two loops of cord. So it's a proper fetal monitoring, like intrapartum monitoring or surveillance, is very, very important for these patients. But of course, you can keep in mind patients are reading so much about two loops of cord and things like that. It's very difficult to convince the patient that yes, these patients can deliver normally. Also, I mean, two loops of cord does not warrant a cesarean section. The labor has to be monitored well, and the labor surveillance has to be done very properly. During the labor, if there's a dip in the fetal heart, you can go for cesarean anytime. But it doesn't mean that two loops of cord, you have to take the patient immediately for a section.
Thanks a lot, doctor, for answering so many queries and for sharing such wonderful talk with us. I hope our 2B moms must have got a lot of tips from you. And thanks a lot for this overall session, doctor.
Thank you,
And thank
Pooja.
you all to be moms for joining the session. And the queries which are not answered, please put them in the iMumz feed section so that our doctors can reply you. And we'll see you again tomorrow at the same time, 6 o'clock. Till then, take care. Thanks a lot, doctor. Again,
Thank you. All the best to all the mothers. Thank you.
right, doctor. Okay, doctor. Thank you. Bye
Okay.
bye.
Bye.